Hi, I'm Dr. Dean Kelaita, Local Health Officer for Calaveras County with a COVID-19 update for today, Tuesday, May 12th. I'll begin with a short report regarding the current status of COVID-19 in California and Calaveras County and move into a description of the variance process that the county is undergoing to enter into stage 2 of the state's current pandemic roadmap. Calaveras remains steady at 13 cases of COVID without any deaths. Hospitalization capacity remains steady, and Mark Twain Medical Center is resuming elective procedures and outpatient surgeries. Testing capability is also slowly expanding with the activation of the OptumServe test site in Lodi, as well as delivery of new testing supplies to the county to strengthen our local testing capacity. Our goal is to meet the state's benchmark of 1.5 tests per 1,000 residents, approximately 500 tests per week. This is the PCR test, and not to be confused with the serology test. This represents one of our community's greatest vulnerabilities is the nursing home here in town, and we're going to be able to test the residents and staff there as well. Contact tracing on the part of the Public Health Department will be increased with more staffing and a computerized system to better be able to track and share information among our jurisdiction and neighboring jurisdictions. Last Friday, May 8th, the governor amended his statewide stay-at-home order, which allows us to move into stage 2 of the 4-stage pandemic roadmap to reopening the state. As I discussed last week, local counties may attest to variance for allowing us to move further into stage 2 than the state as a whole. And that's what we're in the process of doing now in Calaveras County. We have to meet specific readiness parameters, such as epidemiology data that adequately shows we're not getting more cases, our ability to contact trace people who may acquire infection, the hospital capability to surge their beds to take care of new patients, as well as our ability to protect critical infrastructure and high-risk populations like nursing home residents and healthcare workers. At the end of last week, Public Health held a conference call with the California Department of Public Health representatives, and we're beginning our attestation process today. The county has a letter from the Board of Supervisors as well as Mark Twain Medical Center, and once these documents are sent into the state, which will be done later today, and they're approved, we'll be able to move further into stage 2 of reopening the community than the state as a whole. We'll have to watch for potential triggers. In other words, if the virus comes roaring back, it may be necessary to restrict certain business activities or social restrictions again in the future. We'll continue to monitor with surveillance data and be able to know if this is indeed occurring, and actions can be taken to prevent that. The most important thing that the public can do is to continue to perform good hand hygiene, covering one's mouth and when coughing, and limiting trips and activities which are not essential to reduce the chances of interaction with other people who may be infectious. Further information will be released from the Public Health Department to businesses in the community about what it means once we are able to move further into stage 2 of reopening the community, because certain businesses that are eligible will be able to start to conduct businesses not just at curbside service, but as well as in establishment dining in restaurants, as well as in establishment shopping in some situations, assuming that the businesses meet the criteria for showing that they're able to perform the necessary hygiene steps and ensure the protection of their workers and customers. The state will allow us to further move into stage 3, which will be the opening up of higher risk types of businesses where there's more personal contact among employees and customers at a later date. We don't have the ability to do that right now, but we will be able to move further into stage 2 once we get the authorization from the state of California and the appropriate process is underway to be able to do that in our community, and we should know within the next 24 hours that that indeed is the case. Further information is available at our website by going to www.calaveraspublichealth.com and clicking on our COVID-19 link, as well as the main Calaveras County website as well. The state of California also maintains a very robust website to be able to get information on their roadmap to reopening, which will have further information for local businesses on what steps they need to be able to ensure protection of the public. This is an evolving situation, of course, and further information will be provided to the public as soon as it's made available. Thank you for your cooperation, and let's keep Calaveras County safe. It's going